Welcome to another episode of Dying in Grace, the show where we talk about all things about death and dying, healthcare related, and self-care related, so that we become more comfortable with the topic of death and dying. Today, my guest is a really wonderful asset in our Santa Barbara community, and her name is Adriana Marroquin. And I want to just tell you a little bit about her background before I let her come on screen. So Adriana is the Community Initiatives Manager at Hospice of Santa Barbara, and she oversees a collaboration amongst some other nonprofits here in our community, including overseeing the Compassionate Care Program in Carpinteria. What she does is she cultivates relationships, partnerships, in order to be able to serve the larger community. And she's the chair of Mi Vida, Mi Voz, which we'll hear a little bit more about in a little bit. And she's the co-chair of something unique to Santa Barbara, I believe, called the Latino Elder Outreach Network, also known as LEON, which has been running for a number of years. She's worked in a wide range of nonprofits, from working with youth at Isla Vista to Easy Lift Transportation. And now we are lucky to have her as the person with us today to talk about her role as the Community Initiatives Manager. So Adriana, thank you so much for coming today.
Thank you, Arlene. Thank you for having me. I'm happy to be here.
Yes, so I wanted to ask you, so your background is unique. You have a religious studies background and global studies and an MA in business administration. So how is it that you came to, and what was it that drew you to work at Hospice of Santa Barbara?
Sure. As someone who's worked in end of life for a long time, Arlene, I think you would agree with me when, as you ask this question to many end of life workers, they say they kind of just fall into it, right? You don't necessarily have a passion unless you're one of those lucky few that know from the very beginning. And I would say that's really the case for me. I started a nonprofit. I've been working in nonprofits for a very long time. And as I was looking for a new opportunity, hospice just kind of lit up for me. Quite honestly, it wasn't necessarily my first choice. I interviewed because a friend made that connection, and then I felt I had to go through the interview because of that friend. But it wasn't necessarily something that I aspired to be. However, now that I've been there almost 3 years, I wouldn't have changed it. I love working for hospice. I love working with the end of life community. It's really been a beautiful journey, just on a personal level as well as a professional level, working in this field.
Yeah, I have to say that I kind of sort of was prepped for it at some level, but fell into it with a career as a career in much the same way. And I'm wondering, when you tell your friends and maybe family members, when you first said, well, I'm getting a job at hospice, what was the reaction that you got?
It was definitely one of fear, like, oh, wow, and then there's no really follow-up of how do you do that? And it's kind of those scary questions that I think as humans, we're just not really sure how to deal with death and end of life, that even just a job in this field is scary, right? So it's definitely becoming a learning opportunity to those who surround me, that hospice is more than just end of life. It's really a continuum of life in all areas, young to old, doesn't matter.
Yes, I had similar things. I used to joke that I could drive anybody to get a glass of wine at a party once they asked me that question, like, what do you do for a living? It's like, oh, they needed an immediate refill. And what this is the point of this show, actually, is to have us learn about a wide variety of aspects of death and dying, to make us not as terrified, to not avoid it. And it takes all of us together to keep sharing the information so that people slowly get to learn, not that any of us wants to invite death into our lives, but it's inevitable. And the more comfortable we are, the better able we all are to cope with it. And I mean, here we are in COVID, and we're watching a lot of people not be able to cope with it. And speaking of COVID, you know, one of the things about COVID that I think became apparent, probably to the country at large, was the disparity in access to healthcare for people of color in general, for people who are poor. Just it was just such the numbers, the cases. And I'm wondering, your awareness of this disparity, my guess is it predated COVID. So can you talk to me about your awareness about disparity in healthcare in particular prior to COVID, what you knew that most of us didn't?
Sure. You know, that's an interesting question, Arlene, because I grew up in that world, right? I am a first generation Latina. My parents are immigrants. I grew up in low income housing, not the best neighborhood. And so that was kind of my reality, right? And so as I kind of entered college, moved to Santa Barbara, started working on the other side, right, of the service provider now, where all of my life I'd received services. Now I'm providing the services. It was interesting because my peers, right, and so my first job at Isla Vista Youth Projects was in a family resource center. So my peers knew exactly what was happening, right? We had similar backgrounds, serving similar community members. But as you entered higher levels, like CEOs and board members, there was a disconnect about what they saw and what the reality of the folks that they were serving, what they were living, right? So that's kind of been my experience always, right? However, when the pandemic hit, it's really been a great conversation opener of just a reality check for everyone. You know, I don't think that it's people are evil and they don't want to look at it. Not at all. It's just we're humans and we only know what we know, right, based on our experiences. So it's been a great, you know, I try to look at the silver lining in all of these things. And for me, this really was a silver lining of, great, we can't just keep hiding it under the rug anymore. We have to confront it as a community. And yes, that means tough, uncomfortable conversations, but ultimately it's going to lead to a change in the way that we function as a community to ensure that we're all supported equally.
So I agree with you. I also tend to be a silver lining kind of person, which actually is serving me personally well, because we're in it a lot longer, at least than I certainly thought was going to be. You know, when it hit in March, I kind of thought, oh, well, by the summer, things should, you know, and here we are poised to go into another go round. So it's something we're going to be living with for quite some time. And also the after effects. And I would say my concern is primarily the grief that people are carrying for all the losses. So that's really important. So when you say, like, your peers knew and the policymakers, if you will, did not really understand, or just were unaware, because I think we have done a lot of keeping in our own little comfort zone of the boxes of people who are like us. And you know, given everything that's gone on in terms of an awareness of racism and bias and implicit bias, I'm wondering what you discovered with COVID. It was some of that going on as part of the healthcare response here in our community?
Sure. Yeah, you know, Santa Barbara is 40% Latino, I think 45 now almost. Absolutely, those disparities are happening, right? A lot of Latino members in our community are probably working illegally, right? And for whatever way, however way they might get away with it, we have to just be honest and acknowledge that a lot of employees just are not working with their real social security, right? So when COVID hits, when all of the restaurants, essential workers get shut down, what happens to this community who has been getting by in whatever way that they have been? All of a sudden there is no safety net, right? And so then we as a community are reeling of, what do we do with our undocumented community that we know exists, but that for whatever reason we've turned a blind eye because it was never a huge problem, if you will, because they were getting by somehow. So I think with those, right, we see the disparities of access to healthcare. I think the Santa Barbara Neighborhood Clinics, public health do a great job at trying to meet the need, but then there's still work to be done, right? They only have enough capacity to meet these folks. There's only enough to go around, right? Because we just were not aware of how big the problem was. So, with the work of Mi Vida, Mi Voz, a lot of the work that we're doing is advocating. It's raising the voices of these marginalized communities who've lived kind of on their own, getting by with whatever they have, but not necessarily getting the attention of the policymakers. So a lot of the work is really advocacy and shining light on these issues.
Beautiful. So let's back up a little bit. So tell us where Mi Vida, Mi Voz came from. Was it your idea? How was it that you decided to create the information and the other things? Just tell our viewers what it is, how it got started, and the kinds of activities you're doing.
Sure. So Mi Vida, Mi Voz, or My Life, My Voice in English, or MVMV for short, really started around advanced care planning, right? We were approached by Cottage Hospital. The goal was to bring this very important document to the Latino community. There hadn't been a lot of work around bringing this document to the community. So that's really what brought us together. And so Mi Vida, Mi Voz is made up of many organizations, and I'll just name a few that are kind of our core steering committee. It's Housing Authority, Isla Vista Youth Projects, Carpinteria Children's Projects, just a variety of mostly Latino serving organizations. Casa de la Raza is one of those. And we came together around this topic. We had been planning it. We had been in existence almost going on to 3 years. And then, of course, COVID hit in March, right? So quickly, the team realized that there had been an influx of information, great information, but it was not coming from the sources that our Latino community was used to receiving. And so Mi Vida, Mi Voz is really founded on this idea that trusted relationships are really what makes our community move, right? So when we're thinking about the Latino community members, they weren't necessarily going to public health to obtain their information. Although all that information was valid, incredible, and amazing, that's just not the source that they were used to getting their information from. So as the members of the table realized that, we said, well, we already have access as a small community. We have access to this larger community, right? So that's really where the pivot to focus on community COVID-19 resources came about. As a whole, Mi Vida, Mi Voz does not offer any services. What we're doing is really collecting resources from the community, putting them on our website, mividamivoz.com, organizing in a way that's easy for folks to find information, and ensuring that that information is in English and Spanish for folks to access and really get those basic needs met. Because again, COVID really disrupted a lot of basic needs for family, right? Not just housing, but food insecurity, bill payment, childcare, you name it, right? All of those things were affected. So really what we're trying to do is making a resource hub for folks to go in and help connect them to the resources that Santa Barbara community offers, because there's a ton of them, a lot of partners.
And is it for the entire county, or is it just for our city?
We have focused mostly on South County. However, we are expanding into North County. So on the website, you'll see a few North County resources, and we're slowly growing that as we obtain partners up there, and basically doing the same thing in North County.
Well, it strikes me, and I think it's great. I have a question about, because we've heard this too, especially with kids being having to do school online. Um, the digital divide. Is there other things you do in person or distribute, written materials to people who may not even have access to a computer?
Absolutely. So our website, and we have an electronic newsletter that's really intended for service providers, right? The folks who work at all of these organizations who have access to families. That's really the main audience of those two tools. Of course, you hit it the nail on the head, right? The digital divide is so real. So we do print out every other week. We print out a paper newsletter highlighting 6 to 8 resources of the community. And we've partnered with the food bank, with the RISE Ambassador Program, with the promotoras, with business quarters, to pass out this information in paper format to the folks who don't know how to access online or don't have the means. Another great program or partner is the radio. We've partnered with Radio Bronco, and every day they do a little segment, and his reach is amazing. I mean, so many people in the Latino community tune in to hear him, and so we've been able to get the word out 100 times faster through the radio than through any other mean.
Yeah, that's really important, because I just think too, especially people don't have the time sometimes if they're struggling, trying to get work or minding their kids or, doing whatever they're doing. And when the numbers were particularly high and we were all on lockdown, people, I know essential workers went out, but a lot of people, especially if they were elders, it was dangerous to get yourself exposed. So I'm delighted to hear, there's lots of different ways that people need to get information, and hearing it once or just reading it once isn't enough. So it's wonderful to hear the community response. I'm curious, are the churches also assisting you in getting the information out? Because in my view, the church is often a central place that the Latina community, Latinx community goes to, just because it's in their culture, it's in their hearts, it's the comfort that we need at a time like this. So are the churches helping as well?
They are. We can certainly do another round, right? There's always room for improvement, but they have been great partners since the very beginning. Many of these churches also stopped in-person services. So getting creative, right, about how do we reach people when you can't see them in person.
Right.
And so that really goes back to the pillar of why Mi Vida Mi Voz exists, right? It's working through those trusted community leaders. So if the priest for one of these churches advertised or talked about Mi Vida Mi Voz to his congregation during a virtual sermon, that goes a lot further than just a flyer, right? So really tapping into these trusted community members to help spread the word is really what we've been doing.
So it sounds like you've been really working hard. And I know that that there's other languages besides Spanish that the community understands. Can you elicit some? I don't know the names of some of those dialects or different languages. Could you speak to that just a bit?
Sure. So that's, especially as we moved up north, right? These indigenous languages that are made up of different dialects, different inflections. We really realize, right, that that's a need. And so with Mi Vida Mi Voz, we want to operate on this idea or this platform, if you will, that Spanish translation just needs to happen, right? Our community of Latinos is big enough that it just grants for it to happen. And it's just so normal, right? And that's how we're operating. So as we expanded into North County, similar to Spanish, it's those indigenous communities. There is a big migrant farm worker community up there that speak different variances. And so we have partnered with MyCop, who's helping us translate our resources into indigenous languages. And so languages are not written languages, they're spoken. So a lot of them will be audios or video formats of just translation, right? And again, that's within our mission of it just needs to happen because that's what the community needs. And that's the only way that will make a difference, right? Is if the information is accessible in a format that they understand.
And I have to confess my own ignorance because I didn't realize that there were other indigenous, I mean, I knew there was other indigenous peoples. I knew there was Chumash language, but I didn't, I guess I just assumed that people were bilingual. So that, you know, like, and so it kind of, it just put a spotlight on my own ignorance about our community, you know, what I thought I knew and learning what I didn't know.
Sure. And I think in this time of COVID, that's the hat that we all need to wear, right? Understanding that we know what we know, but we also know that we don't know a lot more, right? So as, you know, true confession for me, I've never really worked out of North County. So I'm relying a lot on those partners to tell me, how do we operate in North County? I'm sure it looks completely different than the way that we operate in South County, but you know, I think in this time, having that humble cultural sensitivity of, I just don't know what I don't know, and that's okay, right? Let's just ask for help and work together.
Yeah, I think that that's sort of with all the racial strife and, you know, kind of everything coming forward and breaking wide open in a lot of ways. I can say as a white woman who thought I was pretty aware, I really have been educating myself in lots of different ways to understand what I didn't understand and didn't even know I didn't know. And to me, that's also one of the, I think, positive byproducts of, you know, the challenging times we're in. You know, we can make a choice about using our blind spot to open up and see more. And I think I just want to encourage my audience to take a good look at what you think you know and what you know, what you might discover you have no clue about.
Right.
And it's, and I think that we can, and I think one of the beautiful things that you're doing with the partnerships is looking for the commonality and working collaboratively, which we're not experiencing enough in the United States at this time. It just feels so divisive a lot. And if someone thinks differently or has a different view or looks differently or follows a different religion, I mean, we're seeing the impact of that. And yet we all know, I think, in our heart of hearts that together we'll get through this stuff and we're stronger together.
Mm-hmm.
And it seems to me like Mi Vida, Mi Voz certainly exemplifies that by bringing all these partners together to help people understand what's going on. I wanted to kind of use this idea of what we don't know. So since you work with hospice and end of life and death and dying, what are some of the either things that people may not understand about a Latinx approach to death and dying, or has misinterpretations or misunderstandings about how, you know, and I'm asking to paint in a broad brush here, but some of the stereotypes or misunderstandings about Latinx community's approach to death and dying. Have you encountered people with like just really distorted ideas?
Sure. And, you know, I don't know if completely distorted, you know, I think there's some value to them. I think I oftentimes get asked about large families and end of life situations, right? With Latinx families, especially in the hospital pre-COVID. large families, and who makes the decision. And as a doctor, right, this is coming from a doctor's perspective. I have a room full of family members supporting the death of this person, but then they get in a strife because there's 3 talking heads and I don't know who to listen to, right? And I think, sure, that can absolutely happen, but I think the reason why that happens is because as a culture, death and dying isn't necessarily something that you plan for, right? As in the American culture, there's a lot of planning. It takes us back to advanced care planning, right? And why it's not as popular in the Latino community. I think in the American culture, there is this big push about planning and nursing homes and final wishes. But in the Latino community, I think we're used to just dying in our homes, right? If our grandparents are going to die, there's going to be a whole bedside vigil for as long as they need us to, that it's very hard for us to begin thinking about nursing homes or these other plannings around end of life. So I think that piece is cultural. But I think that we as a community can help ease that. My team at Hospice of Santa Barbara, I work with the patient care services team. I think COVID has really changed that, right? It's really like, sorry, you can't have more than 1 or 2 people at the bedside. And that's difficult for everybody, Latino or not, right? It's just, it's so hard. But I think, again, silver lining, how can we utilize this experience to encourage planning? Because we don't know what's going to happen down the line. So I think that's one of them, right? The large families. And the other is about how do folks, I blanked on the second one.
That's all right. It's all right. Well, let me ask you, do you have a story to tell us perhaps about a shift that you saw with a family, either through Mi Vida, Mi Voice, like they changed something, they became aware of something, or, do you have a personal kind of success story that you could share with us?
On how they shifted end of life?
Or just how, you saw that people shared with you that they got a resource they had no idea was available to them, or, just the impact of your efforts.
Sure. I think collaboration is really big, right? So I can speak to one. Through Hospice of Santa Barbara, we have a partnership with neighborhood clinics, and neighborhood clinics are already an amazing, well-rounded organization. But when they talk to them about PCS and that we can be there with them at the end of life, it doesn't necessarily mean that they're going to pass away, right? It's just additional help during a life-threatening illness. Most of our patients, I would say about 60% do recover from illnesses, and the other 40 are end of life. But that partnership, there was this family in particular who it was a young mother who passed away, left behind children and her husband. And so on a medical point, there's only so much that the team can do, right? After the individual passes, and that's really it. But with our patient care services team, it was about connecting them to resources. And one of the big needs that this family had was financial, right? There was some credit card debt that had been left up. What do we do when our loved one passes away? There's children left, the husband. And so we connected them to other resources to help with these financial crises that were left behind. And I think that was a really neat one. It's something that we don't think about when we're thinking about end of life, right? Unless you're kind of at the end of your life and you have some 401k rollovers, et cetera. But when you're on the younger end, and this is kind of a sudden loss, you're kind of, that's not really at the top of your list, right? And so connecting them with I think it was a financial firm in town just to help sort things out. We made some phone calls to the credit card companies. That was just a really neat and unexpected, I think, resource to the family.
Yeah, that's beautiful. And it's true. I think that the one other lesson that COVID has reminded us is that none of us none of us knows who's going to be next, because, you know, healthy people get sick. And so if that helps us do some planning, even designating a caregiver or having the conversation about what you would want. Do I want to be on CPR? Do I want a feeding tube? Do I want a ventilator? Then it helps move the whole dialogue forward. So we will make sure that we will list your website and your email. And because it's bilingual, I certainly have a subscriber, so I want to encourage everyone listening to subscribe and get the updates so you know what's going on in our community. It's another way to educate. Adriana, do you have any closing words or any final message you'd like to share with our community?
Arlene, this was wonderful. Thank you again for having me, and really to your audience, utilize that website. You know, it's there for you. It's English and Spanish. Utilize it, share it, make sure people are connected. I think together we can really make a difference for the most vulnerable in our community. And, you know, on the other side of planning for end of life, advanced care planning is available. Something that, just a little nugget that I've taken away from this end of life field is that the sooner you can confront your death, the more fully you can live your life. And that's really the message that I try to impart in people as I talk about advanced care planning, because I certainly have seen that shift in my own personal life, just working and confronting death.
Well, I appreciate that message, and I think if we do a little planning and a little confrontation of the thing we're afraid of, we will be able to die in grace. So thank you again, Adriana, for being my guest, and we just really appreciate everything you're doing in our community.
Thank you, Arlene.
Thank you.
Thank you.